This is a Yale High School Studio News Special Feature.
Hello everyone, I'm Alfred Schwaffer.
And I'm Leo Burse. Thank you for joining us for this special feature.
The Bulldog Health Clinic is now open inside the Yale Junior High. Yale Studio News had the opportunities to speak with several employees of the clinic last week during their soft opening. Kira Tabi has more.
Hi, I'm here at the brand new Bulldog Health Clinic. I'm joined by Kelly and Liz, and we're hoping to get some more information about the clinic and its services. Hi Kelly, could you please tell us a little bit about your background, please?
Yes, so I am a licensed social worker working for the St. Clair County Health Department, and I am the supervisor of our off-site school-based health centers or clinics. And right now I'm also the current counselor here for our Bulldog Health Clinic while we wait for our person that we've hired to start next month.
Nice. And then, so how did this clinic get started? Do you have any background on that?
Yeah, so last early spring we wrote for a grant for 2 new locations, so Yale being one of them, and we used like data from some of the surveys that the youth in the community have filled out, like MyFi data and things of that nature, and compared them to other communities and wrote for the grant and got it. So here we are.
So you said you compared with other communities. Do other schools have something like this?
Yes, so Port Huron Area School District has had their teen health center for, I think it'll be 38 years this year. They started off as a modular unit kind of in the back of the school, and gosh, I don't know how many years ago it was, but they got rid of the modular unit and the school paid to develop a full like brick and mortar building. So now they have their own like clinic right outside of the high school. So yeah.
Are you guys hoping to do that anytime soon?
End goal would be to do that. So we'll start off small and kind of see how much use we get. And then yes, the goal would be to expand that and make it more accessible for everybody.
How is this clinic funded?
So it's state grant funded. So everything comes straight from the state government. Every year we renew it, so it's not competitive. The first time we were in competition with other districts and other health departments, you know, statewide. But this time around, we just every year renew it, and they just keep giving us the money as long as it's there. And like I said, Port Huron Schools has had theirs for 38 years. I don't see the funding really going anywhere anytime soon.
Could you tell us about the staff at the clinic?
So we are staffed with a part-time nurse practitioner. Her name is Liz. So she is a master level nurse and can, you know, write prescriptions, treat all kinds of illnesses, injuries, things of that nature. We will have a clerk here that will do will help with check-in and check-out and making phone calls and things like that. And then a part-time therapist for mental health services. So she will be starting sometime next month.
And is the clinic associated with any larger systems or hospitals?
No, so it's just between the school district and the local health department. So the state of Michigan gives us specific guidelines we have to follow, criteria we have to meet, and things of that nature, and the rest of it is just between us and the school.
Great, well, thank you so much.
Yes.
Hi Liz, could you please introduce yourself?
Yeah, I'm Liz. I'm the nurse practitioner over at the Bulldog Clinic here in the Yale Middle School.
For those who don't know, where is the new clinic?
The new clinic is located inside the Yale Middle School, or the junior high, just across the hall from the office. We're in room 127.
So who can come visit the clinic?
Anybody ages 5 to 21. Doesn't necessarily need to be a student of the school. It doesn't even need to be a student in Yale or in St. Clair County.
All right, and what would the basic process be for students looking to make an appointment or come visit the clinic?
So there's a couple different ways. You can walk in to see me. You don't need to have an appointment. You could make an appointment to come see me if you wanted to have a specific time or limit your wait. You could call ahead and make an appointment. The student is able to do that, or the parent is able to do that, either way.
And what are your hours of operation?
We're here 7:30 to 4, Tuesday, Wednesday, and Thursday for the medical piece. And tentatively, our counseling services will likely be Mondays and Fridays, possibly Wednesdays.
Is it necessary for parents to accompany their child?
It's not necessary. It just depends on the parent-child relationship. If the parent would like to accompany, they are more than welcome to. If they just want to have their kid pulled down from class to come during an appointment, that's fine. If the kid comes in, after school or on break, they can drop them off and pick them up later too. Just kind of depends on what works best for the parent and the child.
So is parental consent required for a student to come in for an appointment?
Parental consent is required for 95% of appointments. We need parental consent initially, so if the student has never been to the clinic before, I can take a verbal consent over the phone with the parent, and then I would send them home with a paper consent, and we can, after we have the paper consent, then we'll be able to see that child up until they're 18, and the parent can choose to remove that consent at any time if they would like. We do need consent for vaccine services, so we will never provide any vaccines without written parental consent for that. We do, by law, provide certain services that do not require consent, and that would be things like pregnancy testing and sexually transmitted infection testing. That does not require a parental consent if you're 14 and older. However, we do recommend, having open conversations with your parents.
And can the clinic write prescriptions for students?
Yes. So if someone, let's say, has strep throat, they come and see me, they need an antibiotic, I can send that right over to their pharmacy.
Do students need to have health insurance?
They do not need to have health insurance. We can help them sign up for Medicaid if they need to. We accept private insurance, and if they don't have insurance, they will not be turned away. We do have some cash prices for things, but overall, we will never deny a student services because of their inability to pay.
And if a student did have insurance, what documentation would they need to show you?
If they do have insurance, it'd be great if they had their card and I could make a copy of it. If they don't, our clerk that will be working here can reach out to the parents and get that information if need be.
Okay, well, thank you for the information. Is there any way you could give us a tour of the clinic?
Yeah, sure.
Right in here is where our clinic is, room 127. So when you come in here, this is where our waiting room is. So I would check you in right here, fill out some paperwork. You can sit down and fill it out, get comfortable. We've got some stuff for the kids too, like for 5 years old or elementary kids. We have little squishy pads that can keep them just distracted while they're waiting. Our little bubble machine. And then in here, through this door, is kind of where our clinic spot opens up. So we have our testing here where we do blood draws, hemoglobin, cholesterols, urine testing, vision and hearing we also do. And then in here is one of our clinic rooms. There are two. And we'll do your height and weight in here. We've got the vitals machine, so your blood pressure, temperature, heart rate, the exam table, be able to check in your ears and everything. All the other testing stuff that we would need to do is in here too. So this is kind of where everything happens, and then we check you out at the desk there, get you a pass back to class, and good to go.
So what services can and can't you do?
So we can do quite a lot. We can do your annual wellness visit here. We can do sports physicals, like if you're playing basketball, soccer, swim, you need a physical, we can get that done for you too. If you're sick and you just need to come in because you've got runny nose, sore throat, stomach ache, headache, if you're having an asthma attack or issue and you need to be seen and you're at school, you can come see me. The only thing that I really can't do is x-rays. So I can take a look, let's say if you hurt your ankle, I can look at it and kind of see if there needs to be an x-ray done and refer that out. And the other thing is if you needed stitches, I wouldn't be able to do stitches currently. So I could look at it, clean it up for you, bandage it until you get to where you need to go. So an urgent care for that or not.
Well, great job with that piece. That was a fantastic opportunity for everyone involved.
Thanks. So they did actually make some points off camera that we didn't get to record. So one of them was that they actually can act as a primary care provider, and that can be an option for parents as well. And also, you can go there until you're 21 to act as a bridge.
Yeah, so are people going to be concerned about these extra visitors in the junior high?
So we actually talked to Mr. Nelson about that over the phone, and he did tell us that they do have a procedure in place. So you have to make an appointment if you're not a member at the school, and so they know who's coming in and what time they're coming in. And they also have to buzz in at the office so they know who's coming in. And so if you don't go, they can check in on you and see where you are.
Ah, that sounds great. Stay healthy, Yale High.